Hi, I'm Angela. I'm a certified health coach and a registered nurse. Are you having heart palpitations and wondering if they might be related to menopause? Well, today in this video, I am going to talk to you about what are the main causes of heart palpitations, main reasons that you may be having them, and then what to do about it. I'm going to talk to you about 7 of the main reasons why you could be having heart palpitations. Starting with the most common, which is stress. So stress and panic and anxiety, that category is a major reason why people of all ages have heart palpitations. Especially that feeling of a racing heart. Secondly is just this broad category of substances that can cause heart palpitations, like caffeine, alcohol, antihistamines, cough medicines. They can all have an effect on the heart that can cause heart racing. Fourth cause of heart palpitations is when our estrogen fluctuates. During the years of perimenopause, our estrogen doesn't really drop off yet. Our estrogen is really going high and then really low and back again, all within a short period of time. And that's why we can have hot flashes and also why we have heart palpitations and anxiety. So all of those can be related to the estrogen, as well as even caffeine. Caffeine and alcohol that causes heart palpitations can also cause the hot flashes. So all of those kind of working together to make us really uncomfortable in perimenopause. Number 5 is dehydration. Whenever we're dehydrated, not drinking enough water, our electrolytes can get out of balance, which can cause heart palpitations. And as a bonus, just want to add in there that a low magnesium can also be a reason why we're having heart palpitations. So I didn't include that in my total number, but it's definitely a possibility to consider. Number 6 is food sensitivities. So our body can respond in an immune response to food in 2 different ways. You can have an allergy, which is immediate, and you absolutely know if you have a food allergy. Or you can have a food sensitivity, and a lot of times those go completely unnoticed, but they can really be causing a lot of inflammation in your body. They can cause any kind of reaction, not just heart palpitations. You can be having migraines because of a food sensitivity. There's so many symptoms of food sensitivities. The gold standard for figuring out what are your food sensitivities, if you have any, is by doing an elimination diet. That's where you eliminate the most common food sensitivities for a period of time and then introduce them back one at a time, being very aware of any kind of symptoms you might have, like heart palpitations, for example. The 7th main cause of heart palpitations is hyperthyroidism. So this is definitely one of the less common reasons why you would have heart palpitations, but it is a main cause or it's a main symptom of hyperthyroidism. So it's definitely worth considering. There are a lot of other symptoms that are very common also with hyperthyroidism. So those are some things to look into if you want to know more about that and think that might be the problem. Now, to stop having the heart palpitations, the best thing to do is address the cause. So after talking to your doctor, to go through the main causes, what can be causing heart palpitations and which one is it for you? Figuring that out for yourself and addressing it. But in the moment, whenever you're having heart palpitations, there are a few things that you can do to try to get your heart rate to come back down. One thing that you can do in the moment to get out of an arrhythmia, if you're having an arrhythmia, is to perform the Valsalva maneuver. The Valsalva maneuver is whenever you are bearing down like you're having a bowel movement. That is exactly what it is. It's like you're holding your breath and you're creating this pressure in your chest. Whenever you push, right? Whenever you push the air in your chest, right? So you can kind of get the idea of what I'm talking about there. So you kind of just perform that maneuver, and that can cause the pressure that it actually raises your heart rate and raises your blood pressure. So that is something to be aware of. It will, for a moment, raise your blood pressure, bring it back down, it comes back up again, and that pressure in your heart is what actually can knock it out of an arrhythmia. So this is something that you definitely also want to be sure that it's safe for you in particular to do, depending on your health. And also, in case it is stress related, which again, that's very common, is to do some deep breathing. So taking a big deep breath in, long and slow, big deep breath, hold it for as long as you can, and then blow out as slowly as you can. So like a 5-5-10, breathe in for 5 counts, hold it for 5 counts, and try to blow out for a full 10 counts as well as you can. And just doing that 4 or 5 times can really help to relax your nervous system, which can help you to get out of a stress response that's causing your heart to race. I hope this has been helpful for you. Be sure to hit the subscribe button and the bell for notifications so you get notified every time I put out a new video for women over 40 who want to get their health back and to help you through this time of perimenopause. Until next time, bye for now.